We're just going to leave it a minute while people come into the webinar.
Can you hear me, Saskia?
I can.
Okay.
Saskia, are they in the waiting room or can they hear us?
They're coming in now. They can hear us, yeah. Okay, so I'm going to go through some rules of engagement for the attendees. This webinar is being recorded. No one can see that you are attending unless you would like to ask questions. So if you would like anonymity during the question and answers, please tick the box to send anonymously before sending your question. We hope to make this webinar as helpful to you all as possible. So please do ask your questions. Type questions in the question and answer section. Please direct questions to the panelists only, starting with the name of which panelist you are directing the question to. You may ask the question at any point, but they'll be answered after all the talks. If we don't get through your questions in the allocated time, it's about 1¼ hours for tonight, then we will answer them via email after the session. Remember that this is our beloved South Africa, so if there's load shedding or any dodgy internet connection, please bear with us and we'll resume proceedings as soon as possible. Thank you for joining us tonight. Day 4 of the inaugural National Infertility Awareness Week South Africa, where we'll be talking about donor cycles. My name is Saskia Williams and I'm the founding director and CEO of IFAASA, the Infertility Awareness Association of South Africa. And we are bringing you this week in association with House of Fertility. House of Fertility was established in 2018 and they are primarily an online information hub for couples unable to conceive naturally and who are wanting to undergo fertility treatments. In addition, they provide the emotional support needed for couples who have suffered the excruciating pain of loss. IFAASA and House of Fertility frequently partner together to educate patients about infertility through physical events, and now in an altogether more modern way. This has all been a bit overwhelming at times, but we are delighted to now be able to reach people across Southern Africa, as well as internationally through this forum, and therefore for future events. Let's get started. Our first speaker is Dr. Mohamed. Dr. Mohamed is a fertility specialist at Advanced Fertility Centre. He'll be talking to you tonight about donor egg and sperm cycles. Dr. Mohamed, would you like to share your screen?
Isn't this supposed to... Can you see my screen, Saskia?
No, try again.
Oh, gosh. That little share the screen icon doesn't want to come up.
At the bottom?
Yeah. Maybe I should go out of the whole thing and come back.
You can, just if you move your mouse to the bottom, it should pop up at the bottom of your screen. It's a green button.
Yeah, I saw it before, but it's not coming up now. It's going right through, but it's not coming up.
You can, if you'd like to leave and rejoin and try, that's no problem at all.
I do that?
Yeah. I'll run through the agenda with the attendees whilst you do that. That's not a problem. Okay, everybody. So the agenda is going to be as follows. Dr. Mohamed from Santa Fertility at Advanced Fertility Centre. Tertia, Albertyn.
Maybe you should start with one of the other speakers.
We can do.
Yeah.
Absolutely fine. Tertia, are you ready to step in?
I am indeed. Give me 1 second.
Perfect. That's perfect. We're going to hear from Tertia first, then Dr. Mohamed, then Jen, who's an egg donor, telling her personal story, and Mandy Rodrigues, who's going to be doing Grieving the Loss of Your Genes. I would like to thank the sponsors for helping us to educate the public about infertility. Your support helps us to break the silence, but it doesn't constitute an endorsement of any product or service by IFAASA, House of Fertility, or any of our speakers. Okay.
All right, let's see if we can do this.
You can,
Oops.
yeah, perfect. Yep.
Right. And there we go. Can everyone see my screen?
Yes.
Fabulous. Right, good evening, everybody. My topic tonight is to explain the process and role egg donor agencies play in the journey to become a parent. Firstly, let me introduce myself. My name is Tertia, Albertyn, and I'm an ex-infertility patient myself. My journey to become a parent was a pretty harrowing one, but it has a happy ending and I have plenty to be grateful for. Since my twins were born after my 9th IVF, I've remained very involved in the infertility world. I've written a book about my journey. I've appeared on various TV and radio shows. I co-founded South Africa's largest online infertility support forum. But my biggest and proudest achievement was co-founding Nurture Egg Donor Program, South Africa's largest and most successful independent egg donor agency 12 years ago. Working with amazing fertility specialists in South Africa and our awesome, wonderful, fabulous egg donors, we've supported over 3,000 egg donors and we've assisted over 1,800 couples and singles, and we've had over 1,500 babies born through our egg donor program. And every one of those babies is a very special miracle baby. So let's get back to the topic of my talk tonight. What is an egg donor agency and what purpose do they serve? So after what is a very long time and many attempts to conceive and lots of heartache and tears, you've been told that the chances of conceiving with your own eggs is extremely low, often less than 5%. It's a pretty devastating diagnosis. I mean, no one grows up thinking they will have a baby through egg donation. You grow up wondering whether your future child will inherit your love of dancing or your father's wacky sense of humor. And then you have to face the reality that your dream is no longer your reality. Instead, you have a new reality, one where you need to grieve the loss of your own DNA. And I'm so pleased, just as an aside, that Mandy is talking about that later because it's a big deal. But once you've worked through your grief and you've had some help from people like Mandy, you're now faced with what is the seemingly enormous task of finding and choosing an egg donor or young woman who will donate eggs to you. How on earth do you go about that? Well, there are 3 ways that you can find an egg donor. You can ask a friend or a relative to donate for you. This has both its advantages and disadvantages. I can go into this if you wish. You can ask some questions and I can chat about it later. You can also use your fertility clinic's own donor pool. This also has advantages and disadvantages. Or you can use an independent egg donor agency like Nurture. There are many advantages to using an independent egg donor agency like Nurture, but the biggest advantage is that it gives you choice. The choice to select a donor that meets your requirements, the choice to use your own fertility clinic, and the choice when to do your IVF. And you know, after so many years of having no choice, it is incredibly uplifting to take some control back of your infertility journey. I think the hardest part, well, there are many hard parts, but one of the hardest parts of going on this journey is that it feels like all choice has been taken away from you, all control has been taken away from you. Now, independent egg donor agencies like Nurture are exactly that. They're independent. So they are not limited to just one particular fertility clinic or one geography. They have a wide variety of choices of donors available. For example, we have over 400 egg donors who are able to donate at various locations and clinics all across the country. So what exactly is an egg donor agency and what do they do? Think of an egg donor agency as an expert middleman who makes the process of egg donation easier for egg donors, for future parents, and also for the fertility clinics. For the donors, agencies provide 24/7 support during the sign-up, the screening, the selection, the donation, and post-donation as well. We are the big sister that looks out for them while they go through this absolutely amazing process. For the recipients, we hold their hand while they walk through the process of choosing an egg donor, which is a really big thing. And while going through the exciting but sometimes scary process of IVF. And of course, for the fertility clinics, agencies provide well-informed, well-educated, committed, supported egg donors to their patients. When the donors arrive at the fertility clinic, they know exactly what they're getting into. They've been fully informed of the entire process. This makes it much easier for the fertility clinic to do what they need to do from a medical point of view. Now, the application process to become an egg donor is quite a rigorous one. And I've put some of the requirements up there. You can have a look at them. Probably about only 1 out of every 5 people who apply to become a donor will pass the first round and the second round of screening. There's some basic things that they need to qualify with. They need to be at the right age, between 19 and 32. They have to be medically and psychologically healthy, and they get assessed for that by a psychologist and by the fertility specialist. And they need to have a healthy BMI. And they absolutely have to be able to be fully committed to the process and able to donate. We always tell our donors that there's a difference between wanting to do something and being able to do something. We might all want to help, or we might want to donate our eggs, but not everyone is able to. So that's a big deal. Once the donors have passed the basic requirements, we then ask them to complete a 10-page application form, providing as much information and detail as they possibly can. So as a recipient, when you sign up and you view the donor profiles online, the anonymous donor profiles online, you can get all sorts of information about the donor. The only thing that you won't get about the donor is her identity, her real name, and photos of herself as an adult. You'll have photos of the donor as a young child, her age, her race, eye color, hair color, etc., etc. And then there's a section on the donor's personality and character, which they fill in as well. And again, a whole lot of medical information, academic qualifications, etc., etc. Now, once the donor has passed all the requirements and completed the application process, each one of our donors is personally interviewed by one of our team. They are then, once they pass that interview, they are then loaded onto our database where future parents are able to view the donor profiles online and find out more information about the donors. This is where we become very closely involved with the recipients, helping them choose their donor. We provide as much information as we can. And then what we also do is we have obviously access to the adult photos of the donor, plus we meet them, and we help our recipients, we help find a good match in a donor. So someone who looks like them. For most recipients, this is important. They would like a donor that looks a little bit like the mom to be. And we assist with that process because obviously the recipient parents don't get to meet the donor or see any adult photos of her. Once a donor is selected by the recipient couple, the donor will then be sent to the recipient's chosen fertility clinic to have a medical and psychological assessment. The fertility clinic then takes over the medical management of the donor, but the agency remains very closely involved in the process. So to come back to the original point of my presentation is, why would you use a donor agency, an egg donor agency, to help you find an egg donor? And basically, using an agency gives you choice and comfort. Comfort knowing that the egg donor you choose is fully informed and committed and pre-screens and qualifies as a suitable donor. And that is so, so important, that the donor is committed and fully informed. We don't want donors arriving at their first appointment and finding out that the medication is an injection and saying, oh, but I'm scared of needles, I can't do this. So the lead up to become a donor is actually really intense. We take them through quite an intense process. So we want to be sure that when they say yes, they're ready to donate, they know exactly what they're getting into. You could find an egg donor yourself, but it's not something that I would recommend. There's all sorts of issues that are involved in that. So I wouldn't recommend that at all. You want to make sure that you give yourself the best odds of success. An egg donor agency are the experts in recruiting and selecting top quality egg donors. Egg donor agencies take the risk out of finding a suitable egg donor. They give you choice and they give you comfort. In closing, I just want to leave you with a few thoughts. If your journey to become a parent has led you to the place where you need an egg donor, I want to say to you that I see you. I see your journey and your loss. I know this wasn't your original dream. Your pain needs to be acknowledged and your loss needs to be recognized. However, once you've worked through that pain and loss, I want to celebrate with you because the option of donor eggs is a wonderful, amazing, successful way of having your baby. And please know that this is your baby that you'll carry in your womb, your baby that you will give birth to, and your baby that you will care for and nurture from the moment of conception until forever. My wish is for everyone who wants to become a parent is that they're given the choice to have the baby that they've so longed for. I wish you all the best on your journey, and I want to just end off with a few pictures of some of the babies that have been born through our program. And I'm going to end with my absolute favorite. I just love this hair. Can you believe that that baby was born with that hair and that hairstyle? Best of luck, everybody. I'd love to answer any questions that you have about egg donors, how you do it, how you get involved, etc. But over to Dr. Mohamed, who I hope has worked out how to share his screen. Thanks, everybody.
Thanks, Tertia. That was lovely. And in my introduction to you, which I didn't manage to do, I was also going to say about you being the author of So Close, which is a story about your fertility journey. So it was an amazing book for me when I first started my journey. So I do recommend
Thank you
to other people that are on their journey as well.
Thank you, Saskia. Appreciate it.
Thank you. Dr. Mohamed, are you ready to go? You're muted.
I'm going to unmute myself now.
Perfect. See, you've got this in wax now.
Hey?
Yep. Yeah, I can hear you.
Yeah, but why can't I share my screen? I was able to share it just now.
What, when you were
Can
practicing?
No.
We had it perfectly.
Yeah. And then something happened and it's gone again. I don't know. Okay, there I am. Can you see me now?
I can see you, but we can't see your screen.
So I'm going to share my screen, okay?
Yes, just click on where your presentation is once you've pressed share screen.
Can you see my screen now?
Not yet, no.
Saskia, what are you
No.
seeing there?
I can see you. Would you like us? Oh, no, hang on, there you go. Okay, now go to your presentation. Perfect. And then remember the slideshow little button down the bottom.
What does it look like?
It's that one just right up until before you get to the volume. So further right. There you go. Perfect.
No, you're not seeing me.
Yeah, no, that's perfect. There you go. You got your presentation up.
Okay, so can I start now, hey? Yeah,
Yep.
It looked like I got it. Okay, so I'm Dr. Mohamed. Good evening, everybody. I'm Dr. Mohamed at the Santon Fertility Centre, and I'm glad to be here, and I hope I can be of some help to all of you in answering some of your questions. In terms of selecting, in terms of who goes for a donor, nobody likes to opt for a donor pregnancy. They first like to actually understand what their own potential is for having a baby. That's what they would prefer. But sometimes there are people who unfortunately have left it for too long, or who have some inherited inheritable conditions, and they have now a very poor ovarian reserve, and they would sometimes have to go for a donor. In my practice, most of the people that go for donor usually try their own eggs once or twice before they can actually settle down and go for a donor. And all of them require very, very strong counseling from people like Mandy Rodrigues and company, and they are counseled as to the fact that they will carry the baby. The baby is their baby, as Tertia has said. And it is a wonderful gift for people who are unable to conceive with their own eggs. So essentially, parents are those people that would bring forth a pregnancy. Third-party reproduction, usually there's a third partner involved for a fourth involved. There can be an oocyte donor and a recipient, or a sperm donor and a recipient, embryo donor and a recipient, and of course, surrogates. We won't be able to talk about that today. Now, the donors, Tertia has mentioned how these donors are actually chosen. Once they are chosen, they come to us, and it is our responsibility then to actually explain to them the risks of treatment. More than the risks, also we need to examine them and test for any conditions that may exclude them from the donor program. They also need to know what the future implications to them are if they donate. And because of that, we usually put a limit on the amount of times that a donor can donate. The world has gone very small now, so we must actually think about siblings or half siblings getting married sometime in the future. The recipients also need to know what their health status is if they want to partake in a donor program. For example, if you get our cutoff is, I think most clinics will not accept recipients above the age of 50 or 51. There have been horrible reports about some clinics overseas that have actually done a donor cycle on a 71-year-old, which is totally unacceptable, because by the time that little baby reaches puberty, the 71-year-old may have passed on by then. So the recipients have to be counseled, they have to be examined, they have to be tested to see if they don't suffer from any chronic conditions like hypertension, diabetes, any cardiac complications that may make pregnancy a danger to them. So we're going to talk today about egg donation mainly, and egg donation can be either directed where the donor is a known person to the couple, or it can be anonymous. Most of the donor cycles that we do are usually anonymous, and they send to us by donor agencies such as Tertia's. So most of the egg donor cycles are done by in vitro fertilization. It's quite an intensive process. It is also very, very intricately involved with your emotions. That is why both the egg donor and the recipient have to be counseled about everything that's going to happen to them in the next 2 weeks once it's started. The donor has to be examined for any type of infection, sexually transmitted infection, or any other medical condition, and has to be ruled out, because she will undergo ovarian stimulation to grow the eggs and remove the eggs from her to get fertilized. And her cycle will have to be synchronized with the recipient's cycle. So once the physical and psychological risks have been explained to the donor and the recipient, we can start with them. This is just a little graph to show why egg donation is such a beautiful gift. If you look at the line at the bottom, that's the ovarian reserve of the recipient, and it drops. It shows how it drops when they get down to 44, 42, there's virtually no eggs left, or even those eggs that are left are of very poor quality. But once you introduce them to a donor program, their pregnancy rates are very stable, and they get almost a 50 to 60% pregnancy rate. So this is why egg donation is such a wonderful gift. This graph on the left-hand side just shows the amount of eggs that a person may have at different ages. For example, intrauterine, when they're in utero, at 3 months, they've got about 7 million eggs. By the time they get to 30, they have about 300,000 eggs left. And the graph on the right-hand side shows how the rate of miscarriage increases with increasing age. So the indications for recipient for donor oocytes are usually people greater than the age of 40, those that have diminished ovarian reserve for one reason or the other, those that may be a carrier of genetic disease, and also sometimes we get people who've had multiple ART attempts with a low oocyte and no pregnancy. We assess them, like I said, we do the medical and reproductive history, a physical exam with the pelvis ultrasound. We sometimes look at whether her tubes are open or closed, because if the tubes are open, that's fine. But in the recipient, a hydrosalpinx, which is actually an infected tube, decreases the pregnancy rate. So that has to be attended before we even start. We also do the blood type and the blood group, and all other STD infections are ruled out. If she's over 45, we do a cardiovascular testing and preconception counseling, and we usually get them consulted with a cardiologist. We also do a mammogram if she's more than 40 years of age. The partners of the oocyte recipients are actually not really need to be examined that thoroughly. They have to have a psychological assessment and also know whether they're on the same path as the female. We have to do a blood type and a RH. Actually, the RH factor is important because if the recipient is RH negative and if the donor is RH positive, then she has to be counseled about the suitability of that donor. We do tests for syphilis, hepatitis, HIV, etc. The donors have to be paid, but they're not paid. It's more altruistic attitude of theirs that enables them to donate. They're usually paid for things like transport and for the inconvenience of donating. And of course, all her expenses involved with the donation are met with. We also do a lot of tests which the recipient pays for. So the compensation to the donors for indirect and inconvenience, time and risk are done. The oocyte, the clinical interview is taken where a family history, educational background, stability, motivation for donating, and life stresses are actually taken. Strongly recommend counseling by qualified mental health professionals, and I think Mandy will say something about this. And she also required counseling for factors warranting further evaluation. For those donors that are excluded for some reason, they should be referred to the appropriate healthcare provider for resolution of those symptoms or problems. A patient and family history is taken when they have any Mendelian disorders. That's an exclusion. We also check for major malformations of complex causes, example, spina bifida in the family, in the first degree relatives. And also we need to know that there are no familial disease with major genetic components in the first degree relatives. Exclusions of donors, as I mentioned, if they have any sort of health issues, if they are not mentally prepared for the donation or any other problem, they're usually excluded, but it would be good to get them understand why they're being excluded so that if there are problems, they could be referred. We need to take informed consent, and we need to explain to them the risks of ovarian stimulation, although these days it's not very risky, and we need to explain to them the risk of egg retrieval, the main one being bleeding and infection. So assessment of oocyte donor potential, usually we take into account the age of the donor. We prefer to accept donors under the age of 32. We do a cycle, the FSH3, an intrafollicle count, an inhibin, and an anti-Mullerian hormone. This gives us an idea of how many eggs we could expect from the donor. And then, of course, we need to do matching of the donors. And as Tertia mentioned, we try and get donors that are as closely resembling to the recipients as possible in terms of height, weight, hair color, eye color, race, blood type. And we also try and match their medical history. And also in terms of ABO matching is not such a big problem, but if it can be matched, it's a good thing. RH matching is more important. This is just a little sort of a slide to show how to synchronize the donor and the recipient cycles. There's various ways in which to manipulate the hormones of both donor and recipient so that they fall in the same 2-week period when we actually do the matching and actually do the retrieval and the transfer. We recently, in the last 5 years or so, there's been massive advances in cryopreservation of gametes. And as a result of that, we can sometimes have eggs banked for people from anonymous donors and hand that over to recipients that may come. So women at risk for oocyte loss or destruction can also have their oocytes banked. And we discourage the use of cryopreservation for the sole purpose of circumventing reproductive aging. So when a person tells us that they want to freeze their eggs, we try and tell them, don't do it just for the sake of delaying your fertility. Sperm donor insemination has also been around for a very, very long time. I think it was somewhere around the 1800s. The first pregnancy was obtained in 1953 or 54 with frozen sperm. Again, the indications are male infertility, to avoid passing genetic disease to the offspring, and in single women or lesbian women. This is much less expensive than IVF. And again, to select these donors, they must be healthy, no genetic abnormalities. Age must be between 21 and 40. We strongly recommend anonymous donors, although you can get directed donors. And no employees of any fertility clinic is allowed to be a sperm donor. The sperm donor, after doing all the genetic evaluations and also certain chromosomal abnormalities, usually we have to keep it in quarantine for about 6 months before they can be released for use. And the sperm donors are examined every 6 months while they're in the sperm bank. There are certain issues with sperm donation in the sense that you do intrauterine insemination with that mainly. And the success rate, provided the sperm is normal, is only at about 21% after 3 months, and it goes down to 40%, up to 40% after 6 months. These success rates are also age dependent. And in terms of the legal status, the recipient's partner is the legal father of the conceived baby. Psychological counseling is recommended for the partner. Embryo donation. In terms of embryo donation, this can be done legally. The only thing is embryos can only be prepared for a couple, a named couple. We can't prepare embryos from oocytes and donor oocytes and donor donor sperm and keep it in an embryo bank. So that, fortunately, because of ethical reasons, have to be done for patients who have a female problem and a male problem and are unable to conceive. They should be thoroughly counseled, and also all conditions, medical conditions, should be excluded. If we're doing it, they should be quarantined for about 6 months before they are released. So, like I mentioned, psychological counseling should be done very intensively. And the donor embryo eligibility, it should be basically unnamed, anonymous donors who have undergone strict screening as if they're going for sperm and egg donation. Donor oocyte, the maturation of immature oocytes from donors without medication. Some people do not want to have medication for stimulation, so they do what is called IVM, but that's still in the future. Fertile women who have ovaries removed for benign reasons may donate the oocytes for use for themselves or for other people. There should be, hopefully, insurance coverage for this in some time in the future. Thank you. That's it.
Thank you, Dr. Mohamed. I have got some questions for you after we finished our session tonight, so please stay online. There we go. Jen, are you ready to go? You're going to be up next.
Hi, can you hear me?
I can hear you. Let me just introduce you.
Great.
Jen. Jen is an egg donor, and she's going to be talking to us tonight about her experience and why she donated her eggs. Over to you.
Thank you so much for having me, everyone. Thank you to the doctors. Thank you, Saskia. Super chuffed to have been asked to chat to you tonight. My name is Jen. I am a 33-year-old redhead, green-eyed, white-skinned female, and I live in KZN in the Midlands area. I've been on a farm my whole life, and I am now a restaurant business owner. My restaurant is called The Farmer's Daughter, and I'm super chuffed to be here, and I'm super chuffed to share my story. So basically, my story is that I watched quite a few people while we were little growing up, struggling with infertility. It stuck in my mind. Friends of the family stuck in my mind very hard and fast when I was younger, and when we started chatting about things like that, things like fertility and things like pregnancies and all that kind of thing in grade 10, grade 11, grade 12, I was in biology. I was super interested, and I actually started researching it while I was still in high school and knew that it was something that I wanted to do one day. I'm not a donor because I want to have children running around the universe. Those are not the eggs. The eggs I've donated are not children. They are not embryos. They are not little redheads. They are embryos. They are eggs that I have been blessed with fertility in a great way, and they were donated to families that could not have kids themselves, and I was basically an assistant in that process. It is super special for me. It's something that's definitely not my 9-to-5 job. It's something where I can actually invest in emotionally, knowing that I've been able to help people that I will never know who the people are, and I'll never know the children. And that's absolutely fine with me. It's actually quite special for me just to know that somewhere out there I've been a part of something bigger than just myself. It's a beautiful, I found it an absolutely amazing process. I've donated 6 times through Nurture Egg Donor Program, Melanie and Tertia, the founders and owners of Nurture, have become very, very special friends of mine. I read Tertia's book during the whole time of, or during the time of my donation processes, and Tertia's book just hits so hard with me, not because I battle with infertility, but because that there are people that battle with infertility so hard and so much and so desperately. And I'm sitting here super, energetic, happy. I hope I don't have too many psychological issues. I was screened by the doctors that needed to screen me. I donated through Cape Fertility Clinic with Dr. Suleiman Halen. And yeah, it was one of the most amazing experiences of my life, or six of the most amazing experiences of my life. I was treated like gold from the moment I met Mel and Tertia. Going before that, when I applied to become an egg donor, it was a good 6 months process. 6 months to 8 months. I was on the profile before I had someone inquiring for a match. The forms and everything, the trying to find the family history and your grandparent history, your find that whole process was amazing, because I got to find out so much about my family and what the heart problems or emotional problems or paternal and maternal grandparents and parents and issues in my family and whatnot. It was amazing to research all of that and find out what we're all about, and it was also amazing to know what I'm all about, and what where I came from, and my strengths, my talents, my traits, my personality, and being able to share that with someone that maybe also is redhead, green-eyed, white skin, and yeah.
Jen, you muted yourself there.
Sorry, I don't know what I've done.
No, there you go.
Okay. The process is extremely, extremely special to me. It's something that I'll never ever forget. Again, not my children. Something that I was able to help in a bigger process of, and yeah, just it, yeah, emotionally so fulfilling for me. And having to, and also just the whole industry and knowing and experiencing and seeing the desperation that people go through is completely heart-wrenching, and it's something that I'll never understand, because I'll never have to go through that. I have 2 beautiful healthy children of my own, so yeah, they don't take all your eggs. You have got about 8 billion or whatever. So my kiddies are beautiful, healthy, both with a little bit of red hair and green eyes and white skin, and yeah, really, really healthy, happy children. And those are my children. Those are not eggs that are donated. Those are my kiddies, and I absolutely adore them as a mom. So yes, I'm very, very happy to be here, and I hope that I've covered everything. Saskia, do I need to elaborate a bit more? Can I tell you a bit more of the story? Yeah.
I think that was great, Jen. I think some people might be worried about the fact that, yeah, donor moms or egg donors may want to meet their children or whatever, but as you say, it's you don't feel that way, and for you it's just a cell that you gave up, and that's it, right?
Yep, very much so. I mean, definitely with the most love and with the most emotion and the best of intentions, handing those over, but definitely not my children.
Perfect. Thank you. Thanks, Jen. Thank you for sharing with us. I know it's not something we hear often. I mean, we hear from moms that have had donor babies, but egg donors is something very special to hear from. And thank you for doing what you did and giving those babies and creating families. That's just amazing.
Yeah, absolutely. My pleasure.
Thank you. Okay, next up, Mandy, I see that you're ready. Our final speaker for tonight is Mandy Rodrigues. Most of you know that she is a clinical psychologist in private practice, and she's going to be talking to us tonight about grieving the loss of your genetic material when you're faced with needing a donor.
Okay. Thank you to House of Fertility, Empty Wombs, especially you, Saskia, all of you for putting this together. And I think all the listeners must know that all of us are absolutely passionate about this, which is why we do it, including Tertia, including Jen, Dr. Mohamed, in all different ways. So let me start with my talk. Okay.
Perfect.
So, okay, grieving the loss of our genes, egg, sperm, and donor gametes. I just want to have a say that when I first see recipients, I promise you they cannot say the word egg donation. They have been through so much, and like Dr. Mohamed said, it's not usually your first point of call to say, I'm going to use donor eggs. You've been through a lot of a process already, and like I say, recipients sit there and cry without being able to say the word. Within 2 to 3 sessions, we have got them going ahead. And in my 25 years of working, I've only ever had one recipient not willing to go the route of donor eggs once we've guided them a little bit. So if we have a look at the options here, it eventually becomes a question of, do I want to maybe go the donor egg route, or donor sperm, or donor gamete, or baby or not, or other routes, maybe adoption, maybe other routes. And the in-between over here with the plant is saying, well, let's have a look at the processes that are available and then make that decision. We don't need to commit at this point. So closure, you know, a lot of people come and see me and say, I've now just finished and been told I need donor eggs, and it's this big shock, and this is the end of the road for me. Now I need to come to terms with this. I'm going to show you now a metaphor that I use, that closure and acceptance of the next step walk hand in hand. It is not one, and then suddenly you deal with that one and then the other one. It's also important, you know, donor sperm, egg donors and sperm donors are assessed. Sperm donors becoming more and more assessed psychologically. Recipients, there is no law stating they need to be assessed psychologically, but I think this is something that's extremely important, even for one session, to assume that they're on the same page. Oftentimes, if the husband is very willing to say, you know what, I'm happy to have a sperm donor, the wife, you know, or an egg donor, the wife is kind of thinking he wants the blonde, blue-eyed model who's lying over the Harley Davidson or something. He's betraying me in some way. Mm-hmm. So we've got to have them on the same page. And peace of mind, there is so much data, and I'm an infertility patient myself, and I've gone through many IVFs, miscarriages. I hate the words relax and it will happen. It is not about that, but there is a lot of research that says create peace of mind and fertility happens. So I wrote a chapter on when people adopt or move house, etc. Oftentimes their fertility will go up. I don't know if Dr. Mohamed's seeing it, but look around you, and there are quite a few people during this very real pandemic of COVID-19 which are inadvertently falling pregnant. So let's look at the options. I do not play down the fact that there is enormous grief for the loss of your own DNA. And you do go through a grief cycle of thinking, what about the smile? What about the sports? What about my name that should be passed on to the next generation? But if we look at the process I'm going to explain now, maybe some hope can be born. Now, I often describe, and I was going to do this experimentally in front of you, but I know it wouldn't have worked. People come to me with a jug full on the left of grief that they can't use their own DNA. And they say to me, Mandy, help me come to closure about the fact that I can't use my own DNA. And it doesn't work like that, because there's the empty jug of the possibility of another option, a third-party option. And closure, in terms of anything, doesn't work that you deal with the one, and then there's nothing, and then you start dealing with the other. It is very much what this little boy is doing. It is taking 2 beakers. One jug is full of the sadness and the disappointment. The other one is the potential of a third-party option. And as we start exploring that option, so we're hoping for what we see in the glass there on the right, is that as the loss and the sadness is dealt with, so the expectation and the excitement of a new process is born. And then it's going through, do we look at a known donor, an unknown donor? I think that's the slide I need to have a look at next before I go back to that one. The people who raise the baby, the people who carry the baby, the father who is the father of receiving the sperm, that is the father in the eyes of the law, in the eyes of how the child is raised, etc. It is not the genetic material. If we look at nature versus nurture over the years, we've learned through numerous books that I promise you it is more about the nurture of a child. If you look at the book by Malcolm Gladwell, which was called The Outliers, even people like Tiger Woods, even Mozart, they were encouraged to play the piano 10 hours a day and to compose from the age of 4. There is something said for the way we nurture our children, and that includes in utero, which I'll get to now in terms of epigenetics, which makes a donor or a third-party option more like us than we ever thought possible. I'll show you the field of epigenetics now, and I want you to think of people you know who have children. If I look, I've got a very blended family, but if I look at what makes everyone look like one another, it's facial expressions, it's familiarity, it's the way they laugh, it's the way they pace up and down. They learn those facial expressions and familiarity from one another and from us. If you think of that tiny baby you hold in your hands, not now during COVID, although I'm telling all my moms now to take their face masks off with their newborns. How does your newborn learn a facial expression? They learn it by looking at your face. They learn it when you're holding them. How many times have we seen, I've got a frown line. How many times have we seen people with a frown line whose little babies also have this little, intense little face? Because that's how they learn facial expressions and laughs. Disclosure and transparency, I'll go back to now. Now, thank goodness we've got agencies like Tertia's and various others, and they're able to help us and hold our hands in terms of donor profiles. In order to fill that excitement and that hope of going a step further, it's easy enough in some way to go and have a look at a whole lot of profiles that the agency gives you and to kind of throw out, okay, there's a history of numerous generations of colon cancer. There's a history of bipolar depression or schizophrenia. But eventually, because the donor agencies are very select, like Tertia said, they meet with the donors, they screen them before we do. And once you've chosen a couple of donors, they've worked very closely with us by allowing a couple of us, like your fertility specialist, like myself, maybe like your nurse, to actually have the adult picture of the donor, not to pitch between agencies. And I always say that that is very important. We're all ethical. When we have an independent donor agency like Nurture, it is not to pitch between agencies, but it's to say, of the 2 you like from Nurture, this one looks more like you. And then I say to them, gradually start, so prior to even looking for the profile, I say, here's a couple of agencies, expose yourself. And that first time you open up the agency profile, I promise you, your anxiety will be at 100% and you will close it quickly. And then you'll think, hey, I don't have closure. I'm not willing to do this. But what are we doing is we're hoping that this is going to happen, okay? The next time you go onto the portal, a bit more excited you start feeling. And eventually you start liking the profiles. I can't tell you how many donors I have seen that I actually write down a little star and I say, if I need a donor, I want this donor. I wouldn't do that, that's unethical, but I know who I like and who I don't like. Look at best friends. As they get older, they start looking like one another. Now, I don't know if it's because they go to the same hairdressers or what it is, but their familiarity and the way they behave and their mannerisms and the way they use their hands and even their speech, you eventually can't tell the difference. So I often say, once you've screened for the biological stuff and the genetic factors of egg and sperm donors, look for the personality factors, which is why why an agency would include what book do you like reading, what are your hobbies, etc. I'm an animal lover, so if I pick up that someone doesn't like animals, I don't want my 2-year-old to kick my dog one day and I go, well, that must come from the donor. I want to like the profile and I want nothing to kind of give me doubts about what I've chosen. Let's look at this field of epigenetics. Now, there's a lot here. I'm not going to go through all of it, but epigenetics is this relatively new field in science. I knew maybe 10 years or so. And what epigenetics is saying is that the same gene, so the fact, I come from a horse breeding family, all right? So originally, it was common to put maybe a racehorse's embryo, because IVF in racehorses is very big, into a pony, all right? Because that pony is a brood mare. She just chills in the field. She's going to have a good pregnancy. She's going to look after her baby. And you don't want the racehorse compromised by pregnancy. But what started happening is that the foals born to this pony started looking like the pony. Okay, so the field of epigenetics was born, saying that the same gene can be expressed in different ways, depending on the mother who's carrying it. So just because the donor maybe has a big nose like mine does not mean that she's necessarily going to have a baby with a big nose. It depends how that gene is expressed inside the mom that is carrying her herself. And this kind of information I can still send you. So the pregnant woman's womb is more important than we ever thought possible, all right? We also know that there are many ways that we can form attachment emotionally with that baby while it's in the womb. Okay, talking about assessments, and it is by law, we assess all egg donors. It is starting now that by law, we need to assess sperm donors as well. It's not just passed by the law, but we're trying to do that so we have as much information as what an agency like Tertia would have. It was very interesting. So Associate Professor John Richtolder, now in June during lockdown, he produced a study looking at egg donors in South Africa. And their main reason for donating was altruism. Now you might say, oh, well, you know what, they get 7,000 Rand. Are they not donating for the money? I've been through IVF. I am not going to go through IVF for 7,000 Rand, go through all the injections, all the traveling, the time off work, etc. Most of, and I'm talking probably 85 to 95% of the people that I know are donating for an altruistic reason, and they're donating because they know someone who has battled. The average time, and with Jen, well done to you, Jen, I take my hat off to you 6 times, but the average time donors were donating was 2.48. So less of a reason for us to worry that they might be married or intermarried, etc. Bottom was the compensation that they received. All right. Interesting thing, when I look at why sperm donors donate, what is their primary reason? Now, let me tell you something about sperm donors. They come, they usually have a master's degree or an honors degree, and they're good looking, and they know they've got good genes. And what do they say to me? Everyone that I've assessed this year, I know I've got good genes and I'm spreading my DNA. So that seems to be more with the sperm donors. They don't really get a lot of money, and it's not, and it's just like Dr. Mohamed said, it is not the perception that a sperm donor goes into a bank, masturbates, give his sperm, and that's it, and he can do it every month. The sperm is in quarantine, and it is quite a process. And a lot of us get to meet him, and it's quite a process, and he's followed up quite a while. So assessment of both is very important in terms of motivations. The assessment also covers, now I found it interesting that most egg donors, because they're doing it for altruistic reasons, and sperm donors, they're usually very honest in their profiles. They're very honest. The time that I might, and it's very rare that I turn down an egg or sperm donor, is as we're talking, they maybe say, you know what, I'm not quite sure why my maternal grandfather died at 40. Can I phone my mom quickly? Or let me find out what kind of heart conditions. So they're not hiding that at all, but they're actually just not aware of it. We assess that they definitely committed to the process, because especially with their donation, we know what they go through. They need to be committed to the injections, and the agency prepares them a lot for what they're going to go through. And then, of course, as a psychologist, I look at inherited conditions. And the two main inherited conditions in the family are bipolar and schizophrenia. Obviously, depression that is going through the generations and is not due to an external factor, we would explore that as well. Okay. Disclosure, big debate around the world, all right? In South Africa, it is still law that you don't need to disclose the identity of your donor. In fact, you're not allowed to. At the very bottom, I'm saying, what about known versus unknown donors? If there's time at the end, I can get into that. The majority are more donors from an agency. With a known donor, there is still, all parties need to come in psychologically. We need to understand, are you going to disclose to the rest of the family? Because now you've got 4 people involved. Now you've got cousins that are half siblings, and if the one knows and the other doesn't know. So, you know, and if the known donor doesn't have children at this point, what if she delays her fertility for 10, 15 years and can't have? Now you've got her egg. Okay, so known and versus unknown, you know, most people are going for the unknown. In South Africa, around the world, the trend is we need to disclose who, for the rights of the child. This is all for the child, not for the parents, not for the donor herself. The law around the world is that children have the right to know where they come from, and this gives them a sense of fulfillment. So we have a lot of people coming from around the world because South Africa's law has not changed yet. Disclosure and transparency is still protected of all donors. Now, what was interesting in Prof's study, 75% of egg donors said that they would be okay if the child one day wanted to meet them. The majority of the recipients I see, it's changing, because originally they were very much, I'm not telling anyone. And now they kind of saying, you know what, I can't live with that kind of lie. So we deal with it a different way around. Okay, so like I said, it's disclosure. I say upfront to recipients, if you're considering using donor sperm, donor egg, donor gamete, do not say anything to anyone until you've come to speak to me or a professional. Once you tell one person, like your best friend, one day she's inadvertently going to say, oh, but Mandy kind of looks like you, and you're going to think, why on earth would she say that? Because that is my mom. All right. So reserve that right until we've gone through how you're going to do it. Single moms with sperm donation, I think that's a no-brainer. They need to be told that it's a sperm donor, not like a mother I had 12 years ago who said to a young child, it was a one-night stand, your dad's in jail, thinking she was protecting the child, but what a sense of abandonment and fear this child grew up with, that he had a father in jail. Talk to someone. Something like using donor anything is very isolating because people do not openly speak to one another like they might with IVF or they might with grief. So if you can, join the agencies that are available or speak to someone who is at the clinic. I wish we could have groups, but people are sometimes reluctant to speak about the experience they've gone through. And last thing I want to say, in all my 25 years of doing this, I have never had one person regret having a baby via donor gametes. When that little baby is in your arms, I want to promise you something. Nothing, everything you've been through to get to this point all makes sense, because that little human being would not exist if you hadn't gone through this. And you might worry about attachment, but I promise you that as you go through the pregnancy, we have means of helping you attach so that when that little baby is there, I have moms come and visit me and they tell me about, you know, she's inherited my mom's feet, etc. They completely forget they're talking about a donor egg baby. They go to the ped and they completely forget. And you know what? That's wonderful. So it's not important to them anymore. So I just want to say that to all the donors out there in the agencies, this is something that offers us hope and something that I have never had one person in 25 years regret doing it. Thank you very much.
Thanks, Mandy. Thank you for a wonderful presentation as always. We do have some questions to run through. Let me just get them up. Okay. Tertia, are you ready? I'm going to give the first one to you.
Yes, I'm ready.
Okay. I've used Nurse as an egg donor recipient. However, I had 2 failed cycles. I'm looking to try again, but your site does not have many Indian donors in Joburg.
I'm so sorry about your unsuccessful cycles. That's what I'd like to say first. We don't have many Indian donors, and that's something that's across all agencies across the country. I believe, I am not an Indian person, but I believe there is a cultural reluctance to donate one's eggs amongst the Indian population. And I'd be very interested to understand why. I don't fully understand why. But we advertise to all races and we recruit from all races, but we do have a shortage of Indian, Asian, and Jewish egg donors. However, we've just done a campaign in Durban and we've had some pretty amazing Indian donors sign up there, but much less than we do Caucasian and Black African egg donors.
Thanks, Tertia. And as you were talking about the recruitment, somebody's asked what the general awareness of egg donation is in the public and what is the process of recruiting?
So first of all, the general awareness is quite low, actually. People, I mean, many of our donors that we do recruit, they say they've been through the process, but they had no idea this is something they could do and something that they could do safely. And so there is a big need for awareness amongst both recipients and donors about egg donation and that it's a safe and successful procedure. Sorry, Saskia, what was the second half of the question? How do you recruit the donors? I often joke and say that's like Colonel Sanders' secret 11 herbs and spices. This is obviously what we do to be successful. We do it through various media. We do social media a lot, but what we also get is referrals and word of mouth. So our donors have such an awesome experience that they often tell their friends and their family, and we recruit donors that way. We are constantly looking for donors all the time because obviously we want to give our recipient couples choice. So we need quite a few donors from them for them to choose from. But basically it's online, it's social media, and it's word of mouth.
Perfect, thank you. Dr. Mohamed, there's a question for you.
Okay.
What is the cutoff year for recipient parents? I'm guessing that means what is the cutoff age for recipients?
You know, we have 51, that's the cutoff age. That's according to the South African Society of Reproductive Endocrinologists. They've passed a policy that you should use the 51 as a cutoff because that's the natural age of menopause. You see?
Okay, perfect. And then another one for you, Dr. Mohamed. My known donor would like to know if she donated her eggs, would she have difficulty to get pregnant in the future?
If she has got a normal ovarian reserve, she shouldn't have difficulties in falling pregnant because I don't know how old she is, but at 30, like I said, you have 300,000 eggs. So that shouldn't be a problem.
Okay, thank you. Perfect. Jen, there's a question for you. Jen, are you there? Okay, perfect.
Hello, I'm here.
There you are. Okay, they want to know
Hi.
they want to know how you feel about being a mom and being a donor. Do you feel that your kids have siblings?
So I feel like I am blessed out of my socks to be a mom, and I feel blessed out of my socks to be a donor. And no, I don't feel that they are my kids' siblings. They are completely in their own life. They're with their own mommy and daddy. And as I said, I was just part of it. And my maternal love and my maternal adoration is all for my children. And again, I just want to say how lucky I am to be so fertile. And yeah, does that answer the question?
It does perfectly. Thanks, Jen.
Cool. It's a
Thank
pleasure.
you. Tertia, you mentioned that you do have more Caucasian and Black donors. The question here is, in African culture, there's a lot of superstition around donation, blood, body parts, etc. Does your agency address such issues? And if so, could you share some of the examples? So maybe you could share the percentage of Black donors.
The percentage of donors follows very closely to the demographics of each area. So we have more mixed race colored donors in Cape Town, we have more Black donors in Joburg, and that just follows the general demographics. What we find is by the time the donors come to us, these are donors who have less of the superstition, who've done a lot of research actually, and are quite well informed and well educated. I do understand that there is a lot of misconception and superstition in the general population. So we don't really deal with the general population that much, but I am aware that's something we should do through more talks, through more articles, interviews, etc., like that. But by the time the donors come to us, they are so well educated and so well informed that we don't have to deal with that. I hope that answers the question.
Thanks, Tertia. And also there's one for you about, do you know what the success rate for healthy babies using donor eggs based on your stats?
I mean, it's amazingly successful procedure. Now, I always say in the world of making babies, so much has got to do with the age of the egg. So, I mean, Dr. Mohamed could give more statistics about what a sort of a healthy youngish couple's chance is, but we know that when we work with the top fertility clinics in the country, like MedFem and like Stanton Fertility, our success rate is around 60 to 70% per attempt. So it is amazingly successful. Way more, I think, than a couple trying on a natural cycle. And maybe, Dr. Mohamed, you can give some input on that. But it really is super successful.
Yeah, I agree with Mandy. It's a very successful procedure. and it gets to about almost 60%, 60 to 70%, especially if you're doing it for if the uterus is normal, it's a very successful procedure. A lot of times you're doing egg donation cycles because of decreased ovarian reserve. Now, in that category of patients, especially, it's very successful.
Thank you, Tertia. Thank you, Dr. Mohamed. And Dr. Mohamed, there's a question here about any tips on things to do after egg transfer. Heard many theories of putting your feet up and relaxing, or do you just walk around as normal?
Yeah, you just walk around as normal. There's a lot of sort of mythology surrounding this egg transfer, but it's not. I mean, the egg doesn't implant for about 4 or 5 days in the uterus. It's freely floating, but it doesn't fall out if they get up. So, yeah, they put the eggs in and they just carry on normally. There are lots of patients that come from far afield as Australia who have an egg put in and leave for Australia the next day without a problem.
Thank you, Dr.
Yeah, there's no real problem, no.
Okay, great. There's only 2 more questions, so we'll take them. Dr. Mohamed, last one for you. Someone's asking or saying it's their 3rd attempt with donor eggs. Their doctors put them on a course of pumycin and Covacort for 5 days, and the frozen donor egg transfers on Monday. The transfer on Monday includes the intralipid drip. How effective is all of this to help implantation?
Sorry, I didn't get that last bit, Saskia.
The transfer on Monday includes the intralipid drip. How effective is that to help with implantation?
Okay. There's no real proof that intralipid does help, although there's a lot of suggestions and a lot of anecdotal evidence that it does help because of natural killer cells and all that. But she has lost those pregnancies, you said 3. It wasn't because not receiving intralipid. But having lost so many pregnancies, in our unit 2, we will give intralipid. I mean, we'll give intralipid, we'll give acupuncture, we'll throw everything at it, and we hope for the best. So yes, that's a good thing to take.
Thank you, Dr. Mohamed, and we wish that person best of luck for Monday. Mandy, the last question goes to you. Are you there?
I'm here.
Okay. How many Black patients agree to egg donation? I ask this specifically as I know that culturally ancestral background can play a big role depending on their beliefs, of course.
You know what? I think it's the same in terms of, are they likely to come for counseling? If they are, then they're probably more likely not to tell anyone what they're doing. But like I say, I haven't seen that there's any reason that they don't do it, because they're left with the option of, do I have a baby or not? And possibly go out and have a baby with somebody else. So they're more likely to do it, probably less likely to tell the baby and the extended family.
Perfect. Thank you. And we got through all the questions tonight. So if we did, or if you'd like to ask another question that you didn't get around to tonight, please email it to me. My email address is saskia@IFAASA.co.za. But now it's time to wrap it up. So thank you everybody for joining us and for taking charge of your fertility. Tomorrow, we're going to be talking about surrogacy and adoption. Please register on our website, www.niaw.co.za. You can catch this recording from tonight on our YouTube channel tomorrow. Thank you to our sponsors again for the week, 360 Biomedicine. And the biggest thank you tonight goes to our speakers, Dr. Mohamed, to Tertia, Jen, and to Mandy. Thank you for giving your time and your expertise tonight and your personal journey, Jen. Thank you. We really do appreciate it. And I know that you've all helped somebody's journey, make their journey a little bit easier. So thank you. Please take care, everyone, and keep safe.
Thank you, Saskia.
Bye.
Bye.
Thank you, everyone.
Bye.
Bye-bye.